taking this important and timely initiative, which I warmly welcome. Our collective wisdom and efforts will help us devise a sound and robust strategy for the SAARC region as we fight the COVID-19 pandemic. I wish to thank Prime Minister Modi ji and all the distinguished leaders of SAARC member states for kind words and best wishes on my speedy recovery. Even though we had detected one suspected imported case, but the COVID-19 test proved negative. Yet we are aware of the high risk of possible outbreak at any time. We remain alert from preventing it. We have taken several measures to enhance our preparedness. Our efforts at the moment are geared towards preventing this disease to enter into our country. Our national efforts, I am personally overseeing and guiding the government efforts. Multi-agency coordination committees have been set up at the center, provinces and local levels to mobilize government efforts in the synergetic manner. We have restricted international movements, visa on arrival facility for all foreigners and non-resident Nepalis with foreign passport has been suspended. Movement of this country, movement of third country nationals via land routes has been suspended. Swab test PRC health certificate is made mandatory to obtain visa from Nepali missions abroad for essential travels to Nepal. We have suspended issuance of work permit for Nepali nationals for overseas employment. International passengers are required to go through the screening process at the health desk at the international airport. There are provisions for self-quarantine for certain categories of travelers. We are strengthening quarantine facilities in all provinces, hospitals, and arranged isolation wards and intensive wards for treatment. We are enhancing capacity of hospitals. Health workers are being provided with personal protective equipment and necessary incentives to motivate them. All the permits for mountaineering expedition for spring 2020 have been suspended and all major international conferences have been postponed. Okay. Thank you very much.
Thank you, Excellency. Now I call upon His Excellency Prime Minister Dr. Lote Tshering, who is an experienced surgeon. Prime Minister Tshering, we are all keen to hear you. Please.
Thank you, Your Excellency. Before I start, I would like to take this opportunity to convey my king's greetings to all the heads of the states and heads of the governments here. As we speak, my king is out of the capital. He is in the district places, ensuring healthcare services, ensuring COVID-19 surveillance system, and trying to motivate our healthcare services and service providers, as well as asking all the people of Bhutan to be on the same page when this pandemic strikes Bhutan. So with this, I also would like to take this opportunity to express my king's greetings and greetings of all of us to Prime Minister Oli for his speedy recovery. And similarly, we also would like to wish Prime Minister Hasina for her father's 100th birthday celebration in few days. So with this, I would like to thank Prime Minister Modi for your excellent leadership to bring all of us together, because togetherness is required at all times. But when the whole world is fighting one common disease that we cannot see with our naked eyes, I think it's very important that all of us come together and leave behind our differences. And number two, I think it is very important that we communicate very clearly on this. Communicate between all the leaders of the world, communicate between central government with local government, communicate with the health planners and the people of the nations. So I think this is very timely, and I would like to thank Prime Minister Modi ji for your excellent leadership on this. To tell my colleagues on the experience of Bhutan on the lone COVID-19 positive that we had, it was the 5th of this month, last 5th of March evening, we had one lone imported case, a Bhutan lover, a Bhutan visitor who wanted to visit Bhutan, came to Bhutan, and then on the 3rd day of his visit, he showed some very abnormal sign symptoms, and then on suspicion, we found out that he was COVID-19 positive by evening. Yet we wanted to confirm it, and the confirmatory test came just before midnight, around 11:30 p.m. By then, our health officials had all gathered in the ministry. Even my king also came to the ministry, and we all started because we knew that we had the first confirmed positive case. So throughout the night, we worked very hard. Our surveillance system that was already in place was initiated, activated overnight, and starting midnight till 7 a.m. the coming morning, that is 6th of March, we managed to trace the whole path of the first positive case. We managed to identify all the 48 primary contacts. We managed to send all the contact tracers and surveillance team to their respective places and inform them of the importance of house quarantine that first morning. And then as the day unfolded, we managed to pull them out and bring them to the formally identified quarantine facilities. So over 7-8 hours, we managed to identify all 48 primary contacts from 3 different parts of the country wherever our tourists had visited. And we also managed to initiate the medical team that we had identified to treat in case if he had a positive case. And then he was isolated and treatment started. And it all happened because our health ministry under Minister Dichen's leadership, everything was planned beforehand. And then our king was also awake the whole night trying to coordinate the whole thing and bring all the primary contacts together. So we do not wish to have positive cases in any countries, but to have a positive case in this manner and to be able to identify all the primary contacts and isolate them, I thought was a huge success that we brought in. Then starting from there, we managed to treat him, take care of him very, very well. And his family wanted the patient back home. So he was successfully air evacuated day before yesterday, and he reached his hometown last night actually. So we wish him a speedy recovery. All the people of Bhutan send our sincere prayers for his speedy recovery. But the fact is, since as we all know, and as all the heads of the country shared here, this is our uphill task, because we really don't see our enemy. This pandemic that is challenging all of us do not follow geographical boundaries. That's why, as I said, it's very important for all of us to be on the same page. And as we all know that it affects the elderly people, and it affects more people with comorbid conditions. So similarly, the aftermath of this disease will also affect the smaller and vulnerable economies more hardly than the better ones. So we are equally concerned that as we fight and as we try to contain this disease, we are also concerned about the economic outcomes of this disease. So therefore, I would like to support all the proposals that were made before me, and also to be very, very sure that we all will share our limited resources that we have, share the technologies that we have, and also to have frequent such meetings so that with the changes in time and with the changes of the demand of this pandemic, we also come and regroup ourselves. And I also would like to propose that we must have a similar cooperation in economic get up on this issue, because all the smaller economies are disproportionately hit. So with this, I'm sure my other colleagues will have a lot of points to share, and I also would like to contribute as the discussion goes on. So as of now, I would like to thank all the heads of the states and heads of the countries and governments, as well as Prime Minister Modi, for your initiative. Thank you very much.
Thank you, Excellency. Now I call upon His Excellency Dr. Jafar Mirza, who also has medical experience, to share his thoughts.
Rahim, and Assalamu alaikum to honorable heads of state and government and Secretary General SAARC. First of all, I would like to wish good health to His Excellency Prime Minister of Nepal. Your Excellencies, the COVID-19 pandemic is one of the most serious global health emergencies witnessed in the last 100 years. At the same time, when it has been characterized as a global pandemic, it is deemed controllable as well, provided timely and appropriate public health measures are put in place. With over 155,000 infections, 5,833 deaths, and 138 countries involved, no nation and no region on earth can afford to be unresponsive.